Have you noticed that mornings just don't feel the same anymore? You wake up and that natural vitality you used to count on, it's just gone. No energy, no drive. And most men quietly assume that's just what getting older looks like. I'm Dr. Rachel Ross, a urologist with over 20 years of experience helping men reclaim their health after 60. And I want to tell you something important. What you're experiencing is not irreversible aging. In most cases, it's a circulation and nerve signaling issue, and it's far more addressable than anyone told you. Today, I'm going to show you 2 specific acupressure points that directly influence blood flow and morning response. But here's what almost nobody mentions. The order and timing you apply them matters enormously. Get that wrong, and you'll see nothing. Tell me where you're watching from. And if this sounds useful, subscribe. We're building something real here. Most men assume it's testosterone. That's the first place the mind goes. And honestly, it makes sense. Testosterone is the hormone we associate with male vitality, drive, and physical response. So when mornings start feeling different, when that natural, reliable energy just isn't there the way it used to be, the instinct is to blame low T and move on. But here's what most men don't realize. Testosterone is rarely the whole story. In fact, research published in major urology journals consistently shows that in men over 60, the primary driver of declining morning response isn't hormone levels at all. It's something happening much earlier in the biological chain. And until you understand it, nothing else you try will work the way you hope. Let me explain what's actually happening inside your body. Every morning response your body produces depends on one critical molecule, nitric oxide. Think of nitric oxide as the biological signal that tells your blood vessels to relax and expand. When your brain sends the signal for arousal, whether from physical, why morning response really declines. After 60 sensation, or simply from the body's natural morning cycle, nitric oxide is released into the walls of your blood vessels. Those vessels dilate, blood flows in, and the response happens naturally. That's how it works when the system is functioning well. But here's where aging changes the equation. After the age of 55 or 60, the cells lining your blood vessels, called endothelial cells, begin to produce significantly less nitric oxide. Studies show production can drop by 30 to 50% in this age group. And when nitric oxide declines, the blood vessels lose their ability to dilate fully. Less dilation means less blood flow. Less blood flow means a weaker or absent response, regardless of what your testosterone levels look like. This is why men come into my office frustrated. They've had their testosterone checked, it comes back acceptable, and they're told everything looks fine, but they know something isn't right, and they're correct. The problem isn't the hormone. The problem is the delivery system. Now, there's a second layer to this that almost never gets discussed. Beyond nitric oxide, there's the issue of nerve sensitivity. The primary nerve responsible for transmitting physical sensation and triggering vascular response in the pelvic region is called the Put-in-Dahl nerve. It runs from the base of your spine through your pelvic floor and into the perineal region. As men age, particularly men who sit for long periods, have had prostate issues, or have reduced physical activity, this nerve pathway becomes compressed and understimulated. What does that mean practically? It means the signal from brain to blood vessel gets delayed, weakened, or interrupted. Your body might have the intent to respond, but the message isn't getting through clearly. It's like trying to make a call on a weak signal. The connection is theirs, but it keeps dropping. This combination, reduced nitric oxide production, and compressed Put-in-Dahl nerve signaling is what I believe is responsible for the majority of what men over 60 experience as a declining morning response. And here's the important part. Both of these issues are addressable. They are not permanent. They are not irreversible. They are the result of understimulation, reduced circulation, and years of the body not getting the specific activation it needs. The 2 pressure points I'm going to walk you through today work directly on the system. One targets the nerve pathway, the other targets the arterial blood flow. Together, used in the right sequence, they create the conditions your body needs to restore what it's been missing. I've seen men in their late 60s and early 70s report meaningful changes within 2 to 3 weeks of consistent practice, not because something magical happened, but because they finally gave their body the right input. Understanding this biology isn't just interesting, it's necessary. Because if you don't understand why this works, you'll do it inconsistently, skip the steps that feel subtle, and miss the results entirely. But here's where most men make their first mistake, and it happens before they even try anything. Now here's the mistake most men make at this stage. They hear pelvic floor and they either skip past it entirely, assuming it's something only relevant to women, or they attempt something without understanding the anatomy involved, and they never quite activate the right area. Both mistakes lead to the same outcome: no results and the quiet assumption that this stuff just doesn't work. It works, but precision matters. The pelvic floor is a group of muscles and connective tissue that forms the base of your pelvis. Think of it as a hammock of muscle stretched between your sit bones, supporting your bladder, bowel, and the entire vascular and nerve network that governs male sexual response. In men, this region is extraordinarily important and extraordinarily neglected. The specific area we're working with in this first activation is the perineum. This is the external surface located between the base of the scrotum and the anus. It sits directly over the perineal body, a dense knot of muscular and connective tissue. And critically, it lies directly above the path of the pudendal nerve and the internal pudendal artery, both of which are central to pelvic blood flow and nerve signaling. When gentle, sustained pressure is applied to this point, two things happen simultaneously. Pressure. Point #1, pelvic floor activation. First, the mechanical pressure stimulates the pudendal nerve, essentially waking up a pathway that has likely been compressed and understimulated for years. Second, the pressure encourages vasodilation in the local tissue, the same principle used in therapeutic massage and acupressure, where sustained contact signals the body to increase circulation to an area. Here is how to apply this correctly. Lie on your back, with your knees bent and your feet flat, the same position you'd use for a basic pelvic floor exercise. Take 2 fingers, your index and middle finger together, and locate the midpoint between the base of the scrotum and the anus. You'll feel a slight ridge or firmness there. That's the perineal body. Apply gentle but firm downward pressure, not sharp, not aggressive. Think of it as a steady, intentional contact, about the pressure you'd use to firmly press a doorbell. Hold that pressure for 30 to 45 seconds. Breathe slowly and deliberately while you hold. Diaphragmatic breathing, breathing deep into your belly rather than your chest, is not optional here. It directly activates the parasympathetic nervous system, which is the branch of your nervous system responsible for relaxation, blood vessel dilation, and the conditions your body needs to respond naturally. Without that breathing component, you're only getting half the benefit. After 30 to 45 seconds, release. Wait 10 seconds, then repeat the cycle 2 more times for a total of 3 holds. What you may notice, especially in the first week, is a mild warmth or tingling sensation in the pelvic region during or after the holds. This is normal. It's circulatory. It means blood is moving into an area that hasn't received consistent stimulation in some time. For some men, particularly those who have dealt with prostate issues or long periods of sedentary work, this sensation may be quite noticeable. For others, it's subtle at first and increases over days of consistent practice. I want to be clear about one thing. This is not a treatment for any medical condition. If you have active prostate inflammation, pelvic pain, or have recently had pelvic surgery, speak with your physician before beginning. For the majority of healthy men over 60, this is a safe, gentle, evidence-adjacent practice rooted in the same principles used in pelvic floor physical therapy. Consistency is what makes this work. 1. Session tells your body nothing. 2 weeks of daily morning practice begins to retrain the nerve pathway, increase local circulation, and restore the vascular responsiveness that decades of inactivity have quietly reduced. Now, this point alone won't give you the full effect. The second point is what completes the circuit, and most men never find it. And this is where things get genuinely interesting, because the second point isn't where most people would think to look. While the first activation works on the nerve pathway directly, this one works on the arterial supply. And without addressing both, You're solving half the problem and wondering why you're only getting half the result. The inner thigh region, specifically the crease where the thigh meets the groin, is home to one of the most important vascular structures in the lower body, the femoral artery and its branches. The femoral artery is the primary highway for blood traveling from your core into your legs and pelvic region. The internal iliac artery, which branches off upstream, feeds directly into the pelvic organs. And the two systems are connected in ways that make the inner thigh an important access point for improving pelvic circulation. In traditional Chinese medicine, this region around the inguinal crease has been used for centuries as an acupressure point associated with reproductive and urinary health, referred to in some systems as spleen 12 and spleen 13. Western physical therapy has also recognized this area as a release point for hip flexor tension, which directly impacts pelvic tilt, blood flow, and nerve mobility in the pressure point number 2, inner thigh circulation, lower pelvis. I'm not asking you to choose between Eastern and Western frameworks. What matters is that the mechanism is real. Gentle, sustained pressure along the inguinal crease encourages vasodilation in the femoral vessels, releases chronic hip flexor tension that compresses pelvic blood flow and creates a downstream increase in circulation to exactly the tissues we're trying to reach. Here's how to apply it. Remain on your back with knees bent. Move both hands to where your thighs meet your lower abdomen, the inguinal crease. You'll feel a natural groove or fold in the skin there. Just inside that fold, pressing gently downward and inward at about a 45-degree angle. You should be able to feel a soft pulsation if you're relaxed. That pulse is the femoral artery. You are not pressing on the artery itself, you are pressing just medial to it into the soft tissue surrounding it. Apply the same gentle, firm pressure as before. 2 or 3 fingers steady contact held for 30 to 45 seconds. Breathe the same way, deep and slow, into the belly. You can work both sides simultaneously or alternate. Either approach is effective. 3 cycles per side with a brief rest between each. Some men feel a release of tension in the hip or groin area almost immediately. This is the hip flexor. Musculature responding to the pressure. These muscles are chronically tight in men who sit for long hours, and their tightness directly compresses the inguinal region and restricts blood flow through it. When they release even partially, the effect on downstream circulation can be felt relatively quickly. When this point is used alone, results are inconsistent. Some men notice something, many notice nothing in isolation. But when applied after the perineal activation in sequence as part of the same morning practice, the combined effect is measurably different. The first point opens the nerve pathway. The second point opens the arterial supply. Together, they create the 2 conditions the body needs simultaneously: a clear signal and an adequate blood supply. This sequencing is not arbitrary. The pudendal nerve and the femoral vascular system work in coordination. Stimulating one while the other remains restricted is like pressing the accelerator while the fuel line is partially blocked. Both need to be open at the same time for the system to respond fully. I've had patients in their late 60s tell me this was the first morning practice that produced a noticeable difference within the first week. Not because it's complicated, because it's specific, and because for the first time they were addressing the right systems in the right order. And this is where timing becomes everything, which I'll explain in the next chapter. Here's what most health content gets wrong. It tells you what to do, but never tells you when, how consistently, or what to pair it with. And the result is that men try something for 3 days, notice nothing dramatic, and quietly move on, convinced it didn't work. In most cases, it didn't fail. The protocol did. Timing is not a minor detail with this practice. It is arguably the most important variable. The reason we do both activations in the morning, specifically within the first 20 to 30 minutes of waking, is tied directly to your body's hormonal rhythm. Testosterone naturally peaks in the early morning hours, typically between 6:01 and 8:00 a.m. Cortisol also rises sharply at waking in what's called the cortisol awakening response. And while chronic cortisol is harmful to vascular function, this brief morning spike actually primes your cardiovascular system for activation. Your body is, in the most literal sense, more prepared for circulatory stimulation in the morning than at any other point in the day. Applying the activations during this window means you're working with your body's natural chemistry, not against it. Evening practice has some benefit for relaxation and nerve decompression, but it doesn't produce the same circulatory response. Morning is the window that matters most. Here's the exact sequence I recommend. Before you get out of bed, while you're still warm and physically relaxed, begin with the morning timing protocol minutes of slow diaphragmatic breathing. Breathe in through your nose for 4 counts, hold for 2, and exhale slowly for 6. This activates the parasympathetic nervous system and begins vasodilation before you've applied any pressure at all. Think of it as pre-warming the engine. Then move into the perineal activation. 3 cycles of 30 to 45 seconds as described. Rest briefly, then move to the inner thigh activation. 3 cycles per side, and SAR and gear and bean. The entire practice from breathing to completion should take between 10 and 15 minutes. No longer is necessary. Shorter won't give you the full effect. Now, 2 lifestyle factors dramatically amplify the results of this practice. And I want to be direct about both because most men underestimate them. The first is hydration. Nitric oxide production is highly sensitive to blood viscosity. When you're even mildly dehydrated, which most men over 60 are when they wake simply from overnight fluid loss, your blood is thicker, flow is slower, and the vascular dilation you're trying to stimulate is significantly harder to achieve. Drinking 12 to 16 ounces of water before or immediately after your morning practice is not optional. It is part of the protocol. Thin blood moves, thick blood doesn't. The second factor is sleep position. Men who habitually sleep on their stomach compress the pelvic floor and restrict blood flow through the inguinal region for 6 to 8 hours every night, undoing much of the benefit from the morning practice. Side sleeping, particularly on the left side, keeps the pelvic region decompressed and supports better overnight circulation. If you've been a stomach sleeper for decades, this shift takes time, but it matters. Frequency daily practice for the first 3 weeks. After that, 5 days per week is sufficient for maintenance. Results are not immediate in most cases. The vascular and nerve changes we're encouraging are gradual, built through consistent stimulation over days and weeks, not a single session. Most men report their first noticeable change between days 10 and 18. Some earlier, some later, depending on baseline circulation and how long the restriction has been present. What does a meaningful result feel like? Men describe it differently. Some notice stronger morning response. Others describe a general increase in pelvic warmth and sensitivity that had been absent for years. Others simply report feeling more physically present and energized in the mornings. All of these are signs the system is responding. Be patient with yourself. This isn't a quick fix, it's a restoration, and restoration takes time. Now let me bring this all together because what I really want you to understand is bigger than 2 pressure points. When you first arrived at this video, something brought you here. Maybe it was curiosity. Maybe it was final message from Dr. Ross' frustration that had been building quietly for months or years. That sense of waking up and not quite recognizing the body you're in. The energy that used to be automatic, the response that used to be reliable, the feeling that something essential had slipped away without explanation. I want you to hear this clearly. You are not losing yourself. Your body was under-supported, and there is a significant difference between those 2 things. The biological changes we talked about today, the decline in nitric oxide, the compression of the pudendal nerve, the restriction of femoral circulation, none of these are character flaws. None of them are signs of irreversible decline. They are the predictable result of a system that stopped receiving the specific input it needed. And systems that are understimulated can be re-stimulated. That is not optimism, that is physiology. What you now have is a framework, a specific sequential morning practice built on real anatomy and real circulatory science. It is not complicated. It does not require equipment, medication, or a clinic visit. It requires consistency, patience, and the willingness to show up for yourself in the quiet of a morning before the day demands anything from you. Do it for 2 weeks. Give your body the time it needs to respond, and trust that the system you were born with is more resilient than anyone told you. You You haven't lost anything that can't come back. If this video gave you something useful, a clearer picture, a real place to start, then you're exactly the kind of man this channel is built for. Men who want honest answers, not shortcuts. If that's you, subscribe. Not for the numbers, but because what's coming next is worth staying for. Next, I'm going to cover the one mineral that most men over 60 are quietly deficient in and how it directly affects nitric oxide production, nerve function, and everything we talked about today. You won't want to miss it.